Whether you're rehabbing from an injury or looking to reduce your risk of an injury, strengthening exercises can be beneficial for runners. In this video, we'll cover 4 different exercise progressions that could be helpful for some of the most common running injuries. When looking at the most common injuries in runners, plantar fasciitis and Achilles tendon pain are probably the most common injuries, which is why calf raises are so important for runners because it strengthens not only the gastrocnemius and the soleus muscle, but also the Achilles tendon as well as the plantar fascia. The first exercise is a double leg calf raise. Ideally, we perform these slowly, so it's a 3 to 4 second contraction up as we lift the heels off of the ground, and then 3 to 4 seconds as we lower the heels back down to the ground. This is especially important if we look at the Achilles tendon and the plantar fascia, as time under tension is an important consideration. So we need to make sure that we're loading them with a sufficient amount of time to make sure that those tissues adapt to the load. Another important consideration with the calf raise is that we want to lift the heels straight off of the ground and not go forward. A lot of times we have the tendency to lean forward with the calf raise, but we really want to emphasize that vertical push with those calf muscles. And then the progression is to do a single leg calf raise with everything remaining the same, so we still want to emphasize the time under tension, with each contraction being performed over 6 to 8 seconds, and then also pushing the body vertical and trying to minimize how much shifting forward we're doing. If we need to, we can use the wall for a little bit of balance, but if we can do it without the wall, that'll help to improve our balance while also strengthening the calf muscles. These can also be performed on a slant board or at the edge of a step. This allows us to go through a larger range of motion, really getting the ankle into more dorsiflexion. If we're dealing with an insertional Achilles tendon problem, then this might not be a good exercise to start with because it'll add some compression to the Achilles tendon against the calcaneus or the heel bone. But for things like plantar fasciitis or just general ankle strengthening exercises, this can be helpful so we're making sure that we have good strength through the full range of motion. And then if we want to focus on the posterior tibialis muscle, which helps to control pronation during the gait cycle, we can actually place a ball in between the heels, which will help to load the inside part of the calf and that posterior tibialis muscle. When looking at running, it's mostly in the sagittal plane, which means that the glutes and the quads are important to help push us forward. They're also important when we look at conditions like patellofemoral pain syndrome as well as iliotibial band syndrome. The first exercise is a split squat, and so we want to have our legs separated and then slowly lower ourselves down towards the ground. If we're dealing with patellofemoral pain, then we want to make sure that our feet are separated enough that as we lower, our front shin remains vertical. As you can see here, my shin is going into a positive angle, which just means that there's going to be a little bit more compression of the patella against that patellofemoral joint. And then if we look at the split squat from the front, we want to make sure that the knee is tracking somewhere around that second toe, especially if we're looking at iliotibial band syndrome, so we're making sure we're getting a little bit of glute activation to control the leg. And then we can progress the split squat by adding some movement with a lunge. And we can either do a reverse lunge or a forward lunge. If we're dealing with patellofemoral pain, then it might be more helpful to start with a reverse lunge, as this allows us to keep the shin vertical as we take a step back. Typically when we do a forward lunge, we take a step that's a little bit too large, which just adds more flexion at the knee, which adds more compression. But eventually we do want to add in that forward lunge so that we can tolerate that compression. And eventually, as you can see through this video, I'm doing both a reverse and a forward lunge, so I'm really just working one side through the whole exercise. And then finally we can progress to a marching lunge, and this really just integrates everything together where we're working on the glutes and the quads in a movement that's similar to running, although it's a larger range of motion. We want to start in that bottom lunge position, and then as we go up, drive the knee up, and then back down to that lunge position. At first we want to perform these slowly, but as we feel more comfortable, we can add speed to the exercise as well. And just because running is mostly in the sagittal plane doesn't mean that we should overlook those other planes. For example, the frontal plane, which is side to side, is also important when we look at patellofemoral pain syndrome as well as iliotibial band syndrome. The first exercise is a lateral lunge. We'll start with our feet together and then step out to the side, bending the knee. We can either push our hips back, trying to keep the shin vertical, which will work a little bit more of the hip and the glutes, or as we bend down, we can bend down towards the ground, which will get a little bit more of the quads, depending on which variation we want to focus on. The next exercise is a curtsy lunge, and it not only works the frontal plane from side to side, but now we're working the transverse plane as well because we're adding some rotation in the hips. So we want to take a step back and then reach our foot back behind us, and then slowly lower ourselves to the ground, and then extend back up to that original starting position. And then you might have guessed it, we're going to add the lateral lunge to the curtsy lunge to work the hip through a large range of motion. And so we want to take a step out to the side into that lateral lunge, and then bring that leg back behind us and step into the curtsy lunge. Ideally, we're performing that transition slowly, so we're really working on control as we move through these two exercises, but we can add a little bit of speed to this just like we did for some of the other exercises, especially if we're looking at training for some sort of sport that requires some quick cutting movements, like soccer or football. And then finally, exercises to strengthen the glutes and the hamstrings. These can be helpful for conditions like gluteal tendinopathy, hamstring strains, and various knee conditions. The first exercise is a stiff-legged deadlift, which is going to focus more on the hamstrings, versus a conventional deadlift where we bend our knees, which will focus a little bit more on the glutes and the hamstrings. And so when we're performing this, we want to think about pushing our hips to the wall behind us, so that way we're moving primarily through the hips, and the spine stays neutral as we perform this exercise. The next exercise is a kettlebell pass-off, although we can use any sort of weight or even a backpack at home for a little bit of external load. The goal of this exercise is to slowly pass the weight from side to side, with the only thing moving being our shoulder. This will stress the glutes as it has to control for a rotation of the pelvis. The closer your torso is to parallel with the ground, the more challenging it's going to be on the glutes. So we can either have our torso more vertical or bent over more to make the difficulty a little bit more challenging. The final exercise is a single leg deadlift. So now we're working on the glutes, the hamstrings, and challenging our balance. We can either have the weight on the same side as our stance leg, that'll work a little bit more of the hamstring muscle, versus if we have the weight on the opposite hand of our stance leg, that'll work a little bit more of the glute. And so again, we want to perform these slowly so we have some time under tension with the exercise, keeping our pelvis level, and trying to only move at the hips and keep everything else still throughout the exercise. So hopefully these exercises were helpful. If they were, go ahead and give this video a big thumbs up. If you're a runner and want to see more content, don't forget to subscribe to the channel and then also watch this video over here.